Hello, welcome to our channel. So in this video, we are going to discuss a letter for nurses, and the patient name is Anna Dijana. So it's a discharge letter. So let's read the notes now. You are a registered nurse working at the New Victoria Hospital. Your patient, Miss Anna Dijana, is being discharged today. So, okay, this is a scenario. This patient is being discharged today and you're working as a registered nurse at the New Victoria Hospital. Now let's read the task so that we can just know who's the reader and what we have to write. So here, using the information in the case notes, write a letter of discharge to Miss Kathy Anna, the community nurse of Billiston Community Centre, informing her about patient's condition and her medical and nursing needs. You need to address your letter to Miss Kathy Anna, community nurse, 6 Witchen Street and Glasgow, G696DY, UK. So this is the address of the reader. So it's very clear now. We are writing this letter to Miss Kathy and she's a community nurse and we are just informing her about patient's condition and her nursing and medical needs. So let's read the case notes. Patient name Anna Dijana. Her age is 42 years old and admitted on 15th July 2018, discharged on 25th July 2018. Diagnosis is right proximal tibia fracture and lateral tibial plateau fracture, compartment syndrome. Treatment, external fixation and fasciotomies, right lower leg. Past medical history says she has seizures on carbamazepine, and her medical background is saying that on 15 July 2018, right knee pain after falling off stairs, unable to bear weight on right leg. Social background. She is a school teacher, married with 2 children, non-smoker and social drinker. Medical management in progress. Patient was rushed to OR for 2 incision fasciotomies, right lower leg, post-operation, fractures stabilized with external fixator and fasciotomies performed. Then pain medications were also provided. Nursing management in progress. Wound vac on fasciotomy incisions. Okay. Wound and drainage from the wound assessed for the signs of infection. And if we talk about the assessment, patient is free from infection, wound is red in color, free of drainage, no order of redness, no swelling or pain, vital signs are normal, and patient is resting comfortably. Now what's the discharge plan? Patient teaching about the wound site, signs and symptoms of infection and to notify the nurse immediately. If anything changes, teach the patient how to keep the area sterile by keeping blankets and clothing out of reach of the wound, resting the extremity body part, advising any visitors for the same factors, and teach the patient about the expected drainage. Very clear. So you need to teach about wound site signs and symptoms and also notify the nurse that patient needs to be informed about her condition, and she has given already given the sterile medication or dressing, and then patient needs some information and needs some guidance on wound dressing and body part, and also need to advise if any visitors also need this. So this was all about the discharge plan. Now the task is that we are writing the letter to Miss Kathy and informing her about patient's condition and her medical and nursing needs. Here in front of you, you can see the sample of this letter. So dear Miss Anna, then how you have to start your introduction. It is Miss Dijana, who is recovering from a post-surgical operation on her right leg, will be discharged today. Your ongoing support during her recuperation is being requested, or during her recovery you can write anything. So this is how you have to write your introduction. Now in the second paragraph we have to write when she was presented to us and with which problem. So here Miss Dijana presented to the hospital on 15th of July with pain on her right knee following a fall from the stairs. In addition, she was unable to bear weight on the affected limb. She underwent 2 incision fasciotomies after she was diagnosed with compartment syndrome secondary to fractures on her right proximal tibia and lateral tibial plateau. Also, an external fixator was applied to stabilize her fractures, and wound vacuums were placed on the fasciotomy incision sites. She was commenced on pain medication and wound drainage were assessed for signs of infection. Now, this was scenario what happened exactly. Now, the current status. Currently, Miss Tijana is medically stable and her wound is healing properly with no drainage and no signs of infection. Then, the important message to convey. So, Miss Tijana was advised to keep her wound sterile and rest her right leg. Wound drainage teachings as well as signs and symptoms of infection were discussed with her, and she was encouraged to notify a nurse immediately if infection she suspect wound infection. It would be appreciated if you could provide ongoing monitoring to Ms. Dijana's wound condition and her compliance to the above mentioned health. So this is how you have to write your letter, and I hope this letter is very clear to you. It's a very simple letter. You just have to write the discharge letter and also give the details of the patient to the reader. So I hope you have liked this letter, and try this letter on your own also, and send me the written letters to you so that I can correct them. And just practice, and practice will make you perfect. So don't worry about the exam. Just follow my instructions, my guidance. Stay tuned for the next video. You can subscribe our channel, and also you can contact us for online and offline classes on this given number. Thank you.